As you enjoy the Olympics, we always know there's a risk of injury, especially concussions. From UBMD, Orthopaedics and Sports Medicine, we're joined by world-renowned expert Dr. John Leddy in the study and treatment of concussions. Welcome, Dr. Leddy.
Nice to be here.
You have studied concussions for years and are an expert. What has changed in terms of the treatment of concussions today?
Well, I think what's changed over the last few years is the fact that people are starting to realize that concussions are different in everybody, and so there are different aspects of your physiology that are affected that can be treated by different types of treatments, like balance treatments to your vestibular system, vision treatments for your eyes. And the overall principle is that after a few days of rest, people should start getting a little more active. So this concept of active treatment of concussions is emerging. And at UB, we actually use low levels of activity to help promote recovery.
What are some of the symptoms that we see in a concussion?
The most common symptom after a concussion is a temporary state of confusion, or maybe a brief loss of some memory for the events around the injury. The most extreme form of that would be loss of consciousness, but most concussions in sports anyway don't involve that. And that's usually followed by symptoms such as headache, dizziness, feeling foggy or unable to concentrate. Some people feel a little nauseous afterward. They feel off balance. They sort of feel disconnected from their environment.
How is a concussion diagnosed?
It's diagnosed by a medical professional, either on the sideline in the case of sports. So if a head injury is witnessed, and then a trainer or a doctor can evaluate the athlete, and they'll ask them questions about their memory, concentration. If they answer those things normally, that's a good sign. But then they'll do a physical examination, examine the balance system, the eyes, and again assess them for whether they're able to recall information from earlier that day. And if none of that is good, then the chances are pretty high it's a concussion. And the protocol then is to take the athlete out of play, out of harm's way.
And your advice to parents for young athletes?
The most important thing for young athletes is that either they or the adults that are supervising them recognize that a concussion might have occurred. You know, so by observing for some of these signs, such as being off balance or looking out of it, or these symptoms like headache, dizziness, or I can't remember, the most important thing by far is then to take that child or the adolescent out of that sport so they don't get hit again before they've recovered. And then they should be seen by somebody who knows how to evaluate a concussion before returning to play.
You've given us some great information today. Thank you very much, Dr. John Leddy.
My pleasure.
If you have any type of injury, sports related or not, the doctors and staff at UBMD Orthopaedics and Sports Medicine are here to help. You can find out more about all their services they provide and their locations on their website, which is ubortho.com. They provide trusted orthopedic care for bones, joints, muscles, and concussions. Now, here's what's still to come on tonight's Ozone.